Big bad wolf, you came prowling round my door tonight. Haven't let me in, 'cause I've got such an appetite. I said no, you lost your cool and lay off your fly. Or you can blow, blow, blow like a hurricane. You can't knock me down, no matter how you rage. So blow, blow, blow yourself away. I tried to talk some sense to you, but I didn't dare. 'Cause you huffed, you puffed, and you stopped.
I am the founder CEO of Humetrix, a mobile healthcare IT company based in San Diego, California.
And I know you're from San Diego, but I hear an accent. Tell me about that. Where'd you grow up?
I grew up in France, and I became an American citizen over 20 years ago, but I guess the French accent is still there with me and will not go away.
And so, Bettina, you are a founder and CEO of a company that's pretty well known. I just saw Farzad, do a whole video where he was basically pointing to the iBlue button. What were the challenges for you as a woman to, found and run this company?
So I think as a woman and as a woman physician, you come with a big advantage. I think you come with a sense of mission and a passion for what you do. So when I discovered the field of computer science and what could be done with it to transform healthcare, it has been my drive to do it for 20 years. Humetrix is my fourth enterprise, but everything has been driven by the mission and the passion to make a difference in healthcare, but starting and with the patient in control of their health.
And so I'm assuming you went to medical school in France?
I went to medical school in France. And then won a prize for my medical thesis in Paris, and the prize award was to come spend a year sabbatical anywhere in the world, and I picked the US, and I never returned, as a few immigrants do experience. And so I was an oncologist, immunologist, and became a public health officer in California, and started my first company over 20 years ago, and became an entrepreneur ever since, but physician.
And so in France, I'm assuming you're a little bit younger than me, but you probably were at the age where women still had trouble getting into medical school. Was that an issue in France? Make it a whole sentence.
So in France, at the time when I went to med school, yes, there were few women. We were a minority. And in the world of business, there were very, very few women. And at the time, it was unknown and even unauthorized for a physician to step outside its field. So as a young woman, curious to learn and do and make a difference, I found the right territory to express myself, which was the US and not France.
And there aren't many tech CEOs who are women. There certainly are some, but mostly it's still dominated by men. Do I have that right? And if so, how were you able, how did you really have the impetus to even think about doing a startup?
There are few women tech CEO and very few healthcare IT CEO who are women. And why is that? I mean, there are fewer women who get into computer science and IT. You have more men software engineers, and as a CEO of a company and for 20 years in IT, I've been leading a developer group, which are mainly men, and I am a woman at the top. But like many women, I love science. I majored in math when I was in college. And so for me, there was a logical path to apply, my scientific aspiration, with the medical field, and put the two together, and create a company to deliver product which will make a difference. And again, I believe that even if we are few of us as women in the field, I think we can make an extraordinary contribution.
And do you think you can make a better or a different contribution than men? Make it a whole sentence.
I think we can, as women in healthcare IT, we can make a significant contribution because of, I think maybe, and in some instances, a more impactful one, and some men, because as women we are often caregivers. We understand, I think, the full spectrum of healthcare as caring for others, and not only for ourselves, and not only driven by building personal wealth, but trying to indeed make a difference in our community and beyond. So I think women's aspiration to care and to do and to be good organizers, I think that those are wonderful traits to do wonders in my field, which is healthcare IT. And
tell me about your mentors and role models. Who helped you along the way that was memorable?
I would say that my first mentor has been my mom. I have a wonderful mom who is in her 80s, and she's still a performing soprano artist. And she started on her artistic career in her 40s after she raised her 2 kids, which was a lot of work. And but she always had the inspiration to learn, to do, to challenge herself, and so she was a wonderful example for me to look at.
Any messages that she gave you that you think were key in being able to accomplish all the things that you have?
You can do it.
Believe it. Says you can do it.
Yes, believe in yourself. You can do it.
Why don't you make that a whole sentence, because that's really great.
I think what my mom taught me from the start, and still do today, is that you can always do it. There is no barriers when you want to apply yourself. Come with your passion, your heart, and your hard work, and it will happen.
And so you're here at XX in Health today, and there are a lot of young women. What would you say to them?
Well, here I am, at XX in Health, and I am struck by the intelligence, the roundness of those young women I meet, extraordinary young women. I think the world is in good shape to have those women in the field of medicine, healthcare, IT. I'm not sure I can teach them anything. They come with a drive, with the education, with a will, with intelligence, and I guess my only not advice, but a word to them is that indeed you can make a tremendous difference. And I think what is wonderful in the event, which is this Access in Health today, is the ability that event had to assemble numerous women covering all the the spectrum in healthcare, and from the provider side to the payer to the policymakers, government, media, and so forth. And I think that's a powerful group to be impactful. So I'm glad to have come today.
Good. I just have a few other things that I want to ask you about. One of the issues that the young women always raise is work-life balance, and how can I do this stuff and become a leader, but also, have a nice family life and have children and raise my children and do all of that. So any thoughts you have about that?
The key question about balancing our lives, I think at the end of the day is to be fulfilled by what we can do and express our talents, and whether it is to, at the same time, care for a family, do a good job in whatever career we are. I think it's up to us. We have to find that internal degree of fulfillment and happiness to decide what works for us. And it will happen one way or the other, and most of the time it's imperfect, but is life perfect, but it's exciting.
And anything else you'd like to say to the women who are going to watch this film eventually?
I think we live exciting times in healthcare where everything has to be think through and, in fact, redesign. Let's bring many women in leadership positions just to do that, so that we can solve big healthcare system problem, but without big economic problem, and make a difference. So embrace this field. There's a lot to do in it. So my contribution to healthcare is to try to empower patients so that they can have the means to receive safer and more cost-effective healthcare. And so for that, we have developed a transformative technology called iBlue Button, capitalized on a national policy called Blue Button. It's being able to use your phone, your tablet, wherever you go, and pulling the information you need most when you access healthcare, your history, your list of medications. So it's of use now for Medicare beneficiary, for veterans, and with the application of new standard called Blue Button Plus, then this iBlue Button app will be the means of enrollees in private plans as well who can, with this app, access with just a tap of a button their critical health history to share that with their physician wherever they receive care.
So I'm the I'm the CEO of the healthcare of my family. How would I use iBlue Button? Can I get my husband's data and my kids' data and my grandchildren's data?
So as it turned out, a large number of our iBlue Button users are family caregivers of patients covered by Medicare, for instance. So as a family caregiver, you can download the iBlue Button app from iTunes, the iTunes Store, or from Google Play on your phone. And with your mom's or dad's authorization, you can sign them up for accessing that Medicare Blue Button record with the iBlue Button app. Coming next month will be, in fact, a caregiver version of iBlue Button. So as a caregiver, I will be able to use this app to access not only my mom and dad's Medicare Blue Button account, but also mine and those of my kids. So I can indeed manage as a CEO of my family the healthcare of everyone I care for. So today, iBlue Button serve over 70 million Americans, those covered by Medicare, veterans, Americans covered by TRICARE, active duty military and their families, and Aetna. But as more health plans come and adopt the Blue Button program to provide easy access to that claim information to their enrollees, the iBlue Button app will be able to do what we do right now for Medicare, transform that claim record, which is not that useful, into a very practical, actionable record in your hands, on your phone, you can share with your physicians. So new standards are coming into play, which will encourage those payers to just do that and not keep their data into their own silos, but offer that data of access to their enrollee with whatever applications they choose to access that record in a practical way.
And are there any implications for the exchanges that are going to go live at the beginning of next year? Not the health information, but the health insurance exchanges.
I think with the venue of Health Information Exchange, this is a good opportunity, in fact, to apply this Blue Button initiative to plans offered through those exchanges. As we do throughout our lives, we do change plans, we age, we then enroll into Medicare and so forth. With the access of claim data through those various health plans, which could be encouraged by the marketplace, by those exchanges, we could carry our record in a longitudinal way on our phone from one plan to the next And an application like iBlue Button will let you just do that, aggregate the data, and have in your hand at all time your record, even when you change plans. So I think this is a policy which could be applied to exchange, and whether you are one of those new individuals covered by the expanded Medicaid program, then qualify for a commercial plan. Our technology could indeed today, if we have access to those Medicaid plans or commercial plans, have you carry that personal record from one plan to the next and have a full history you can bring to your physician.
So this, although this is very patient-centered, in a way, it says to me, this was the goal of the RIOs, or, in the old days,
yes.
The CHINs. And so now with the mobile phone, we've taken all of the barriers, right, that made the RIOs so difficult to implement and done it right here.
Yeah, absolutely. I think, in the old view of a provider-centric system, we always thought that the data and the information could only go from physician to physician or provider to provider. And I think mobile technology made us discover that if we, with our phone, can access anything online and do our own private banking with our phone, why not in healthcare, where we can be our own connector to that information those doctors need and couldn't get and still cannot get in a comprehensive way using those whole concept of exchanging information provider to provider. The patient needs to be engaged not only to be informed, the patient needs to be engaged to carry that information to his physician who badly needs that information to deliver and to prescribe the right drug and make the right diagnosis and apply the right treatments.